Hello, and welcome to the American Liver Foundation's Ask the Expert series. I'm Charlie Thomas, and I will be your moderator for the program today. Today, we will provide information about caregivers and mental health. We recognize that the challenges of chronic liver disease causes stress to patients, but however, we also know that chronic disease also affects those around them that are their caregivers and take care of them. This would include family and friends. Our goal today is to address some of the special needs of caregivers and to offer tools to help people involved in daily caregiving activities, help them with their loved ones that are diagnosed with liver disease. We have two esteemed presenters who will speak today. Before we begin, I would like to share a little bit of my background. I received my Master of Social Work degree from Arizona State University in 1980, and my Bachelor of Social Work degree in Social Welfare from San Diego State University in 1979. I was employed as a transplant social worker at Banner University Medical Center in Phoenix for 42 years and retired this past April 2022. I'm married to my wife, Linda, who's a retired chemistry teacher. And we have two adult children, Jesse and Andrea, and we just welcomed our first grandchild, London. I enjoy bird watching, gardening, and reading, and I currently work part-time as a liver health specialist for the American Liver Foundation. Our presenters for today's program are Dr. Kris Cooper and Dr. Christian Cornelius. It is my pleasure to introduce them to you. After 38 years of employment, Dr. Kris Cooper retired from her psychologist position at Banner University Medical Center in Phoenix, and that was in May of 2021. As a University of Arizona Clinical Associate Professor, she served as a faculty member in the Psychiatry Residency Program and was active in the teaching and supervision of residents and medical students. Her primary interests were in medical psychology. Dr. Cooper served on the consultation liaison team, providing inpatient psychological services to the medical center. She maintained an outpatient practice, assisting people with a variety of concerns, including caregiver issues. She served as a consultant to the transplant team of the medical center, and she assisted both transplant recipient and donor pre-surgery evaluations. Since retiring, Dr. Cooper spends most of her time traveling to see her three granddaughters, spending time in the outdoors, and gardening. Dr. Christian Cornelius is the medical director of the Inpatient Psychiatry and Clinical Professor of Psychiatry at Banner University Medical Center, Phoenix. He attended medical school at the University of Arizona College of Medicine in Tucson and completed his residency at Banner University Medical Center in Phoenix. He also has been involved with the center's transplant program for over 25 years as the consulting and liaison psychiatrist. His areas of interest include mood and anxiety disorders and psychopharmacology. Dr. Cornelius was born in St. Louis, Missouri, and he was raised in Arizona. Dr. Cornelius is married with two children. His hobbies include golf, fishing, daylily, hybridizing, and reading. Thank you both for joining us tonight. We have received some questions in advance of this program, so let's get started and try to provide some answers. The first question is for you, Dr. Cooper. Dr. Cooper, we had a question from someone whose wife was diagnosed with liver disease. Their family is scattered across the country, and they have stopped seeing their friends and no longer participate in church or other group activities. How can someone in this situation cope with feelings of isolation and loneliness while being a caregiver?
Thank you, Charlie. You know, what I really like about that question initially is that awareness that this isn't okay. And I think it's important to name things. Sometimes we can get caught up in deciding whatever the flow is what's normal, and it's not normal. And just declaring that could be helpful. I want to emphasize that we need to connect. And the first thing that I'd recommend is to make sure that the couple or whatever the family unit is living together takes time for non-medical time together, that there's connection about life that isn't about solving problems or planning the medical events that need to happen, but to be the people they've always been, sharing interests. I like to have people spend a little bit of time with gratitude finding and just noting simple, small things that they're grateful for. Not the same old, but maybe it was a particularly beautiful sunset, but finding that. So not neglecting, connecting in a meaningful way with those people you are living with. And then from there, it is a new normal. And so say yes to those contact opportunities that come up that maybe are a little bit outside of your comfort zone. If a neighbor asked you to stop by, whatever's available. And then finally, I would ask you to remember that virtual contact really does help, looking for virtual support systems, and certainly connecting virtually with your family and your loved ones, making time for that. It's important.
Thank you, Dr. Cooper. Dr. Cornelius, another person whose husband has been diagnosed with liver disease feels that she is not getting important information about his health. Her husband is not telling her about conversations he has with his doctor. How can she help him when she is not being provided with this important medical information?
Thanks, Charlie. Yeah, this is an important thing. When I'm seeing patients for evaluation, oftentimes I will bring the family in for part of the assessment. But when you have a patient who doesn't want their family there, it is a concern. And I would encourage that spouse to talk to the husband about what is it about the husband is feeling that they don't want that person there in the room. Sometimes I encourage the family to write down a list of questions, to ask the spouse, can we have these questions answered? If they still don't want them in the room or a part of it, they can ask the spouse if they could reach out to the provider outside of the visit hours to see if maybe just the spouse is or the patient is uncomfortable with the questions being asked with them present. But then that provider can talk with the family member and get those questions answered. If they're still uncomfortable with that, because those would still require the patient to sign a release and let the doctor talk to them, the family member can always reach out to the clinic and just ask for community resources about liver disease and what to do as their role. But ultimately, we really do want the caregiver and the patient, everyone to be sort of on a team and working together. And so it works best that way, because many times the doctors not only will spend some time talking about the patient's issues, they will spend some time talking about the caregiver issues. There may be things that the doctor can advise the family member on where to put their energy, what are some times that they can get sleep and rest, and where can they need to do more focus. So having that interaction with the providers as family is really important, and we really would encourage that team approach.
Thank you, Dr. Cornelius. Dr. Cooper, is it normal for caregivers to feel some resentment about how liver disease and caregivers is impacting their lives?
A resounding yes. It would not be normal to not have those feelings. And I think it's important to remember that the reason those feelings are normal, some resentment of what is gone, is that you loved your life. You love your life. You miss those joyful experiences that are harder to come by. They're less frequent. You miss those connections. And it's healthy to have those feelings, to have some resentment, to kind of want to scream, no, I want my normal life back. When is that going to happen? And so absolutely, It's completely normal.
Thank you, Dr. Cooper. Dr. Cornelius, along these lines, we received a question from someone whose spouse has an alcohol addiction that led to his liver disease. She blames him for causing his health problems, and she feels trapped, angry, and sad. Can you address this, please?
Yeah, when I'm seeing patients with organ failure, there are many times where behaviors or lack of adherence to treatment did play a role in them getting sick. And it's very natural to be very upset and want to go back in time and change what has already happened. And it's very normal to feel some of that resentment and frustration. But what I encourage people to do is try their best to move past that and focus on the present and use that past experience to maybe change some behaviors. So work on focusing on what's going on currently, focus on what can be done in the future. If it's an alcohol issue, getting sober, doing treatment, going to meetings, AA, and staying sober in the future. If it's not adherence to treatment, it's going to the doctors regularly, taking medication. But basically, try not to focus on what went wrong in the past, but focus on what can happen currently and go right in the future. And if a family member is really still having difficulty moving past what happened before, is maybe they need to have some outlets where they can discuss and maybe get some counseling to work on those things themselves. But really validate that those feelings are natural, but really try to focus more on current and future rather than live in the past.
Thank you, Dr. Cornelius. Dr. Cooper, what can caregivers do when their loved ones experience mood swings, exhibit anger, or lash out at them?
First, I do want to say stay safe. And, while I hate to think that you might be in that situation, we know that intimate partner violence is too common, and it is not your job to put yourself in any physical or emotional risk. And so first, stay safe. And if you feel in danger, get out and get help and let your loved one's doctor know that it is not a safe situation. So I hope you're not in that situation. And so at the emotional level, I really want to emphasize that no matter what has been said, yelled, screamed, hinted at, it's not your fault. It's not your fault that they feel that way. It's not your fault that they're suffering. It's not your fault. Even if you made a mistake, it's not your fault. You are a loving caregiver. Even if you don't always feel loving, you are a loving caregiver, or you wouldn't be there. And you're not a perfect caregiver. There's no such thing. So first, have compassion for yourself, because it's hard to be with someone who's having a lot of emotional turmoil. And then, of course, have compassion for their experience. They are having a difficult life situation, most likely unwanted, and they need your compassion. Set boundaries. And what I mean by that is kindly let the person know that it isn't okay to be treated poorly, that you are sad for their, concerns, but that doesn't make it okay to be mistreated. And encourage them to get the appropriate mental health care that can support their resilience and their best functioning through a difficult time, so that you can stay connected, as we talked about in the last question, and stay together through what is understandably trying. So, it's a difficult, important question, but those are some of my thoughts about that.
Thank you, Dr. Cooper. Dr. Cornelius, What can caregivers do to meet their needs as their loved one's illness progresses and their needs for care increase? One person asked, when do my needs get met? And how do I cope with the guilt I feel for thinking about my own needs? Another wrote, I'm constantly worried about my husband. I'm losing sleep and feel that my own health is being jeopardized.
Thank you, Charlie. Working on an inpatient psychiatric unit, we frequently will get the helper in the family that gets hospitalized because they get severely depressed. And they are too empathic, and it gets to an extreme where they give their last shirt off their back and then freeze. And I try to explain to them that you shouldn't feel guilty by prioritizing your own health. You can be a better caregiver if you are strong. If you are not sleeping, putting all your energy on the person you're caring for to the exclusion of your own health, you're going to deteriorate and your caregiving will deteriorate. And so it's very important to be a little selfish because it'll make you a better caregiver. And so that's what I encourage them to do. And sometimes that requires scheduling time, scheduling me time. If you have it in the schedule and it's regular, you have a better opportunity to reach out for people in your support system for help. You can say, hey, Tuesdays at 4 o'clock, I need somebody to cover for a few hours so I can go to my meetings, and then see if somebody will reach out. I can't tell you how many times when people come in our psychiatric unit that they have this huge outpouring of support from other family, and the family is literally saying, why didn't you let us know you needed help? And the patient will say, because I didn't want to burden anyone. But in reality, there was a lot of people that say, please burden us. We know you're under a lot of strain. We want to help. And so they need to get past that guilt and reach out for help. And the second thing I'd like to point out is there was a study looking at patients who had renal disease and the caregivers, and they found that the patient sensed the overburdening of the caregiver, and it was directly correlated with the patient themselves having a higher amount of depression. And so the caregiver's burnout was being kind of transferred to the patient, and they could sense that. And what we've learned with organ disease and depression is that patients who are going through depression are more likely to be hospitalized, to have complications and problems. And so it's important, again, for that caregiver not only to be strong for themselves, but to be strong for the person that's caring them. And so those are the things I would sort of emphasize when they feel guilty about taking care of themselves, because it goes beyond them. It has far-reaching effects for those around them.
Thank you, Dr. Cornelius. Dr. Cooper, people understand that as caregivers, it is important to take care of themselves. This question is, how are they supposed to do that when they are facing so many demands and stressors?
I think it boils down to what I would call value-based decision-making. That the most important thing is to remember what is the most important thing in this moment. When we get busy, when we're stressed, we're often on autopilot, and we just kind of plow through our day as if it's a checklist. And it doesn't really matter if something was very important or urgent. It was the next thing. Maybe it was just the next thing that caught your eye. And so take a pause before the next action, between tasks. Take a pause and reflect, what is most important in this moment? So you're not completely caught up in that autopilot, and you can live your life by your values and by what's most important. There isn't going to be time to do everything that needs to be done, much less everything that you want to get done. And reconciling that's just how it is. And so choices, and want to be your best choices of really reflecting on what will help the quality of this moment the best. And I'd also really echo what Dr. Cornelius was saying about saying yes when people offer to do things, that this is not an ordinary time. I often like to say it's an extraordinary time, extraordinary, outside of ordinary. And that means that doing some things that aren't ordinary or within your comfort zone are exactly what are called for. People want to help. You may remember a time yourself where someone you loved was in hurting for some reason, and you wanted to help, and it was more miserable not knowing how to help than if they say, yeah, go to the grocery for us. It feels good to help. It feels good to be able to contribute to a situation that is difficult. And finally, I'd say learn some quick ways to sort of manage stress. So one real quick thing I like to do is called drop 3. Drop your jaw, drop your shoulders, drop your stomach. That takes 10 seconds. And really interspersing these little things through your day. So as you're pausing, well, now what's really most important that I do next? Take a moment, look outside at nature, drop 3, learn how to do diaphragmatic breathing and take 10 good breaths, not just 10 breaths, and focus on a moment of gratitude. So really thinking about what are some brief ways, no, you probably don't have time to go to yoga every day. That would be a great thing to do. But there are some small interventions that are effective and helpful that are really worthwhile. And I'd encourage taking just a little time to go on YouTube. And if you Google meditation, there's a bunch of really brief meditations you can listen to for free. You can watch video on different breathing techniques, and that can be really valuable use of your time.
Thank you, Dr. Cooper. So finally, Dr. Cornelius, not everyone can afford to go for private counseling. It can also be difficult to find support groups for caregivers of people with liver disease. What can they do to get the support that they so desperately need?
Thank you, Charlie. Yeah, outside of actually finding a therapist or counselor or getting additional treatment formally, there's a variety of resources now. We're living in this age. If they're working, they could always explore their job to see if they have an employee assistance program that can offer usually up to 5 free sessions with a counselor through their work. Respite offers some help for caregivers. In fact, going to a person's doctor, if the doctor writes an order, sometimes that can be very reduced or even free through some insurances where they can get some respite help, which could be, allow for some travel outside or actually just for a few hours a week. There's some opportunities there. There's a lot of apps that you can get on your phone now that have deep breathing, mindfulness, relaxation, things like that. In fact, employers now are starting to do apps where they actually can get a live person that can meet with people on the phone. So those are opportunities. They have some online caregiver support groups that are no cost that can be available. So there's a variety of resources. And to piggyback on what Dr. Cooper mentioned in terms of 3, I went to a leadership conference a couple months ago, and they mentioned coming up with 3 good things each night, just before you go to bed, just before you put your head on the pillow. The last thing you think about is a reflection on that day and what were 3 good things that happened. And what was interesting is if you did that for 2 weeks and they compared it to people that didn't do that, 9 months later, the people were feeling still more positive just by doing that for 2 weeks than a group that didn't do it. And it just forces you to kind of focus on how can you see what's positive and going on in that day. The other thing was interesting, and I was doing a little reading on successful caregivers, and it found that those that look at the illness and see some positives, some silver linings, some opportunities that the illness has presented, tended to cope better. And so there are opportunities maybe of looking at those positive and good things. Even though there are many challenges, looking at some of those opportunities can really instill a lot of positivity and help through difficult times.
Thank you, Dr. Cornelius. So on behalf of our presenters, we want to thank all of you for participating in this program. We hope the information provided will be helpful for you as you navigate the role of caregiver. Special thanks to Dr. Cooper and Dr. Cornelius for sharing your expertise to help people who are doing all they can do to help their loved ones affected by liver disease. For additional information, please visit the American Liver Foundation website at www.liverfoundation.org, www.liverfoundation.org. You can also reach a helpline specialist by selecting the live chat feature on the website or by calling 1-800-465-4837. It's also 800-GO-LIVER, 1-800-GO-LIVER. The helpline is available Monday through Friday, 9 a.m. to 5 p.m. Eastern Time.